Thank you very much, Mr. Speaker. Mr. Speaker, here in Ontario, the most prosperous province in the country, there are 2.5 million of our neighbours without a family doctor, and that number is only getting bigger. This Conservative government has increased the provincial debt by over $100 billion. So we have to wonder, where is all that money going, Mr. Speaker? In Ottawa, there are at least 160,000 residents without a family doctor. Residents like Teresa, who spent years on wait lists for a doctor to help manage her yet undiagnosed medical issue. She finally got rostered, Mr. Speaker. 3 months later, the doctor promptly left Ontario for greener pastures somewhere else in Canada. Now, Teresa is now spending her time bouncing between walk-in clinics, putting her employment in jeopardy while she awaits yet another family doctor. And there are millions of stories like Teresa's, Mr. Speaker, in the most prosperous province in the country, with a government that spends billions like it's monopoly money. Why are so many Ontarians, like Teresa, stuck without a family doctor?
Government side will come to order. The member for Essex in Parliament, Mr. Pell.
Speaker, of course, people like Teresa need primary care and deserve primary care. We want to provide that to everybody in Ontario, and in fact, approximately 90% of the residents in Ontario have access to primary care and are connected with primary care. Some of that is provided by the fantastic nurse practitioners in the province of Ontario, and I note once again a Liberal member has stood up and refused to acknowledge that nurse practitioners actually deliver primary care. I don't know why the Liberals don't have any recognition of nurse practitioners, but let's talk a little bit more about
members come to order.
There are 296 interprofessional primary care teams in Ontario with nurse practitioners serving 4 million clients. Why won't the Liberals recognize that? What have they got against nurse practitioners? Nurse practitioners are delivering great care, patient-focused care, team-based care. We believe in that. Why don't the Liberals?
Member for Ottawa South will come to order. The Minister of Transportation will come to order. Supplementary question.
Thank you, Mr. Speaker. You know what? This government will blame whomever they want. They might even go back and blame Tommy Douglas for creating Medicare, Mr. Speaker, but they've had 6 years to get it done, and the problem is worse now than when they started. 2,000 people getting health care every day in the hallway. 200,000 people waiting for surgery or a diagnostic procedure. 11,000 of those people dying while they wait, Mr. Speaker. In the Premier's own backyard, in the great state of Etobicoke, there are 93,000 people without a family doctor. That's 1 in 4 residents of the Premier's riding without a doctor, Mr. Speaker. By the time the next election is scheduled, those 93,000 people will join over 4 million Ontarians without a family doctor. The government has had 6 years to get it done and make things better, but it's only gotten worse. Can the Premier tell us and all residents of Ontario why he thinks we should give him even more time to make it worse?
Transportation will come to order. Minister of Red Tape Reduction will come to order. The Minister of Long-Term Care will come to order. The Premier may reply.
Well, Mr. Speaker, maybe the member from Orleans...
Ottawa South will come to order.
Mr. Speaker, maybe the member from Orleans could answer the question. Why did their party, when they were in power, they cut residency spots as we've increased them by 40%? You never built any medical schools, and we have TMU, we have York, we have U of T, we've added seats in Northern University and in Ottawa right in your own backyard. Why didn't the previous Liberal government build a new hospital in your area? Because you never did. We are building the second largest hospital in Canada in their area. I want to know, through the member, why did you fire nurses? Why did you fire nurses under the Liberal government as we brought on 80,000 new nurses, 30,000 more nurses in colleges?
Thank you. Stop the clock.